Today marks World AIDS Day, and it's the second year it's taken the backseat due to the coronavirus pandemic. Various lockdowns and restrictions around the world have dented efforts to fight HIV/AIDS. Deputy President David Mabuza delivered the keynote address at the official government event in Limpopo earlier today. Our senior reporter Siphamandla Goge is there. He joins us now live. So, Siphamandla, has government announced anything different to its approach in fighting HIV in South Africa?
Well, not at all, except to reiterate that we do not need to take our foot off the pedal in fighting HIV and AIDS. Of course, of late, the focus has been on fighting COVID-19, but Deputy President David Mabuza, who is the chairperson of the South African National AIDS Council, going at length there to say we do not need to be derailed or to be defocused as the country in terms of fighting HIV and AIDS. You know, saying it's still with us, even though progress has been made. There are challenges, particularly in rural villages such as Chikundu here in Limpopo and other parts of the country. The issue of stigma and discrimination is still very much rife, and Deputy President Mabuza urging communities and South Africans at large to basically make sure that they eradicate stigma and discrimination against those who are HIV positive, but saying people need to go back to the basics to ensure that they play their part, or they play their part rather, in fighting HIV and AIDS. You know, saying it's a pity because there are these two challenges that we have to deal with as a country. Even though HIV and AIDS has been with us for a number of years now, we are grappling with COVID-19. So in the midst of fighting HIV and AIDS, the country and the world now has to fight COVID-19. You know, David Mabuza, they're saying another challenge in South Africa is the issue of poverty, inequality, unemployment, but also gender-based violence and femicide in the country is one of the things that need to be eradicated.
Yeah, so let's talk then about the difficulties our government and in particular the medical facilities in South Africa face, because we're trying to fight HIV as well as a pandemic that's really came at a time when no one expected.
Indeed, you know, that talks to the issue of defocusing and derailing all the efforts that are being made to deal with HIV and AIDS. Now the focus has to be on brutal COVID-19, but the health minister, Dr. Joe Phaahla, was very clear to say we can as a country fight these two together, but saying of course they were linked in a way that both of them, they require government resources which are very limited, and they have stretched the country's fiscus and budget, but also at the same time you cannot afford to choose which one to fight. Both of them, they need to be fought and to be defeated. So, you know, the health minister was appealing to South Africans to say, while we fight COVID-19, which is very much a threat as we speak right now, with the numbers increasing, saying the numbers will continue to increase and there will be more new variants that will be detected in future. We have seen with the latest variant that has been detected, you know, the health minister also appealing to the world leaders and the countries of the world to say they need to stop punishing South Africa for reporting the latest variant earlier. But he appealed to South Africans to continue to play their part in fighting HIV and AIDS and also COVID-19. Let's take a listen to him.
These struggles also have a lot in common, because both these viruses, there are ways in which we are fighting and trying to defeat them. Both of them, there are methods of what we call the personal health safety measures, which we need to evoke in terms of fighting these two viruses. On the one, which is the HIV and AIDS, we know the personal health and safety measures. I'm sure we still remember the ABC. I hope we have not forgotten. You know we must sanitize these days, but I hope as we sanitize, we remember ABC. Can anybody remember what is ABC? Abstain, be faithful, and condomize. So that's the ABC of HIV and AIDS.
Being faithful in 2021, eh? Yeah. So anything else from the Deputy President and the Health Minister about the travel bans following the detection of the new variant? We've heard from the Health Minister and the President in the past. Anything new though?
Well, I think the clearest message came from Health Minister Dr. Joe Phaahla, who was very clear to say those travel bans need to be lifted. He said he has engaged with his counterparts from the United States of America as well as the United Kingdom, saying there are no basis to impose those travel bans. He feels that they were overrushed, the world overreacted, and there is no need really. Also bearing in mind that there were reports that the new variant was detected earlier in Europe before it was detected and reported by the South African scientists. So the health minister has appealed to the United Kingdom and the United States of America and other countries that have decided to place South Africa on the travel ban or the red list, saying that will affect the country's economy, the country's tourism industry that is still struggling.
All right, our senior reporter Siphamandla Goge covering that story for us.